I'm here to speak to you today because as General Secretary of the Royal College of Midwives, but more importantly, as a midwife with years of experience of working in the NHS, and I still practice as a midwife, I want to see the Health and Social Care Bill scrapped. The health service is facing a colossal challenge in the next few years, achieving massive and unprecedented efficiency targets with a frozen budget and ballooning demands on its services. In my own area, the number of babies born in England each year grew by over 120,000 in the last decade, and is projected to rise by another 35,000 during this Parliament. Being required simultaneously to cope with these massive pressures and the unnecessary, bureaucratic and costly distraction of the reforms proposed in this bill is too much. The bill has been struggling its way through Parliament for a year, and it is our assessment at the Royal College of Midwives that the fundamentals of the bill have changed little. We have not heard anything at all, despite many conversations, that convinces us that this change is necessary. Our health service is already one of the best in the world. We do not need this bill. The case has not been made. The Royal College of Midwives took the decision to go into battle and oppose the bill outright when we asked ourselves finally what the NHS will look like in 5 years if this bill goes through. Now, I could paint many pictures, but I have very little time, so let me focus simply on the lifting of the private patient cap. And despite reassurances just today, they will make no difference. And I know from my experience that when private services run alongside NHS services, the NHS women suffer. Believe me that if you are a head of midwifery on a busy day on a labour ward with too few midwives, you will feel obliged to ensure that the paying women have one-to-one care in labour. The other women will have to share the midwives who are left. This is not fair, it's not equitable, and it leads to worse outcomes for the women using the NHS. I don't know about you, but this is not a future that I or any of my midwifery colleagues want to see or see replicated for other patients in the NHS. It is time to kill the bill.